The reason why you're not getting through this is because you're not being aggressive enough with your lifestyle choices. This is you finding the combination of lifestyle strategies that you can adhere to and that you can maintain for the rest of your life. That's the ticket to lasting weight loss. That's the ticket to optimal health, to get better results, better fat burning, better appetite suppression, and lower side effect profile. So always go with tirzepatide if you can get your hands on tirzepatide, if possible. So what's the difference between all of these medications out there in the GLP-1 space? That's a great question. My thoughts on Ozempic as far as, so Ozempic is the active ingredient is semaglutide. Semaglutide is the first real big GLP-1 medication that came out. It was actually FDA approved in 2017. And it's a powerhouse. It's a powerhouse tool that, like I was saying earlier, allows an individual to deal with food chatter, deal with the disease that we know as obesity. And so if we are struggling to shut that chatter down, if we have real issues that go alongside it, and then I think I'm all for it. I'm all for it because we won't be able to get the weight loss started without it. We're trying no banner today because I was told to try no banner today. That's why there's no banner. So guys, if you want to get access to any of the free resources that we're talking about, I'm actually running a really cool promotion today. If you follow me on Instagram today, I will give you guys this awesome free guide. All you got to do is, like I said, follow us on Instagram today. But you're going to want to follow us on Instagram anyways, because there's so much content that I'm putting out. If somebody can put this in the comments for me and pin it, freeguidenow.com. I know you can't put the .com, but freeguidenow.com. If you go there, there's going to be a big button that says follow Instagram. If you guys follow me on Instagram today, you guys can get your hands on this copy. This guide is phenomenal for multiple things. 3 big categories that this guide will help you with. Number 1, it's your longer fasting guide, specifically how to implement longer rounds of fasting. Number 2, it's going to help you bust through weight loss plateaus. This is a big deal. In fact, this is probably the most commonly recommended thing that I get asked for is, how do I bust through my weight loss plateau? How do I smash through it? How do I beat it? And how do I prevent it? So this free guide is going to help you get through all that. And then finally, it's going to help you with medication independence, specifically how to graduate through your weight loss journey off of semaglutide, off of tirzepatide, to a point where you can maintain your weight without dependence upon the medication. So a tremendous amount of value. All you guys got to do is follow us on Instagram today, and that they'll send you the copy right away. If you go to the freeguidenow.com, follow us on Instagram, and then fill out the little form, and then bam, they're going to send you the guide now. Right. It's Colorado Medical Solution singular. Or you can just go to that freeguidenow.com, click the link, and it'll take you right to the Instagram. So what's the difference between all of these medications out there in the GLP-1 space? That's a great question. So we have 2 active ingredients here, right? 2 compounds. Even though there's 6 different names, which I know is confusing, there is only 2 compounds that we need to worry about. The first compound is semaglutide, okay? Semaglutide goes by Ozempic and Wegovy. Those are brands. Those are brands, names that are indicated for a certain medical condition. Ozempic is FDA approved for diabetes, and Wegovy is FDA approved for obesity. Then the second, and by the way, this semaglutide is what we refer to as a GLP-1 agonist, okay? So it stimulates the GLP-1 receptors, all right? Then we move on to our favorite, which is called tirzepatide. So tirzepatide is a dual agonist, stimulates both the GLP-1 receptors alongside the GIP receptors to get better results, better fat burning, better appetite suppression, and lower side effect profile. So always go with tirzepatide if you can get your hands on tirzepatide, if possible. That medication is FDA approved for diabetes, known as Mounjaro, and then approved for obesity very recently, actually, and they call that one Zepbound. So I know it's like a lot of names, but you get it down, you start to study this, and you realize there's only freaking 2 compounds. It's literally just 2 compounds that we're talking about, but you just got all these names. How do I know which one is best for me? Truthfully, they're both indicated for the exact same thing. And, at the end of the day, it's going to be preference of the practitioner, but there really is no indication for Mounjaro over semaglutide or vice versa. If you are taking one of them and let's say you can't tolerate it, the side effect profile is too much, you can certainly try the other one. And so that could be an indication for possibly switching. But at the end of the day, they're both indicated for the exact same thing. Tirzepatide is actually proven in the research to not only have a stronger effect, a stronger appetite suppression, a stronger control, it also has a lower side effect profile. It's also got better fat burning too as well. It really is the upgrade from semaglutide. So definitely want to get your hands, but don't get me wrong. Look, if all you can get is semaglutide, I'll make that work, because for us, it's all about lifestyle choices, right? Here's what makes us special and what you're not going to find with any other clinic is that we actually help our patients achieve lasting weight loss by coaching deep lifestyle interventions, deep sustainable lifestyle interventions. And it's me personally, I do the coaching every single week in my private community. It's freaking awesome because these men and women are doing what people think is the unthinkable. They're freaking fasting for a 48-hour fast every single week. The weight is flying off their bodies. We're implementing proper nutritional strategies, supplement protocols, resistance training, sleep optimization, stress management. And I'll tell you guys, if you want to beat obesity, if you want to beat insulin resistance, autoimmune issues, deal with PCOS and menopause in terms of the weight that you can no longer lose, because that's how women describe it. It's like a switch was changed and all of a sudden now I'm gaining weight, or all of a sudden I can't freaking lose weight anymore. Let me know if the comments if that sounds all too familiar, because we hear that every single day. Then the reason why you're not getting through this is because you're not being aggressive enough with your lifestyle choices. Like, this isn't a lack of drugs. This isn't a lack of chemicals or anything like that. This is you finding the combination of lifestyle strategies that you can adhere to and that you can maintain for the rest of your life. That's the ticket to lasting weight loss. That's the ticket to optimal health. And being part of my community, following my path, I'll make it as easy as I possibly can for you. But at the end of the day, you're going to have to do some work. You're going to have to implement some of these strategies and adhere to them. But I can promise you, like the fasting, for example, we make that so much easier because we utilize science, right? Getting someone to fast on tirzepatide, getting them to fast with peptides like AOD 9604, for example, even though that one, we're losing that one here with the recent changes. We got other powerful peptides, growth hormone secretagogues. We got powerful supplements so that we can maximize our metabolic flexibility. So that's the ticket to success. Clips, we can actually help you. We still have access to that peptide. Guys, if you are either looking for your free guide or you were thinking about getting coaching or any of these medications or peptides, by following Instagram today, you can participate in a discount too as well. So make sure you go to that website I told you guys about earlier, freeguidenow.com. And then on the bottom of that page, after you follow Instagram, you could either get your free guide or you can schedule your consultation. So either way is an option for you right now. That's freeguidenow.com. How old do I gotta be to get AOD? No one's really asked about an age requirement. Everything is a case by case clinical decision from our providers, but generally the people that need AOD tend to be older. I would say older than teenage and 20s, usually 30s plus. But AOD and other fat mobilizing agents, like it's not the only ones, right? We like sermorelin, tesamorelin, growth hormone secretagogue peptides. Those are pretty awesome, and those are really safe as well. Yes, these peptides do require prescriptions, and this is what you can get from our clinic, the necessary blood work and the necessary medical oversight so that we can ensure you are getting the right sort of protocol. Peptides are amazing, guys, and I love them. I think peptides, truthfully, could be the future of medicine if we didn't live in the day and age of so much suppression. And I'm not going to go any deeper into that one. But if you can still get your hands on these peptides, we still have access to them, and they make a big difference. There's gut healing peptides, there's anti-inflammatory peptides, there's appetite suppressing peptides, a lot of options in front of us. So I think for the struggle of lasting weight loss and metabolic health issues, I like the combination of something that mobilizes body fat in addition to suppressing appetite. The combination of both is very powerful. So I say this very candidly. You guys do with this information what you will, but you need to stay the hell away from research companies. And you don't have to take my word for it, but Dr. Andrew Huberman, a well-respected neuroscientist who puts out, he's got 5 million followers, I think now, talked about it in his recent podcast. And same thing that I've always said, stay away from those online research companies that say not for human consumption, for research only. You have potential contaminants, specifically lipopolysaccharides, that can be dangerous. And you won't have that, or the risk is significantly lower, I would say, when you get your peptides from a clinic that works with a state-regulated compounding pharmacy. Now, is it dangerous to mix peptides? It depends on what we're considering a peptide. Some people call GLP-1 medications peptides, and I would say that's an incorrect classification. Peptides are naturally occurring in the body, and so a pure peptide would be a peptide that hasn't been altered. These GLP-1 medications are altered incretin hormone peptides. So they are genetically modified, is one way to think of it, modified in a way to get their potent response that we love and that we benefit from. But that's why it's a drug. That's why it's no longer a peptide. Being a cycling female, there are weeks where I shouldn't fast. On the other weeks that I can fast, can I do a 48-hour and eat for a day or two, then follow another 36, 48-hour? Fasting is so much easier on the tirzepatide and AOD. That is a freaking great question. Being a woman, there's certain times where you should fast and certain times where you shouldn't. That is correct. It has to do with your cycle, 28-day cycle, day 13 to 15, day 18 to 28. Now, if you're on AOD, if you're on powerful fat mobilizing peptides, you actually may be able to fast. So that's a whole nother conversation. But their question specifically, on the weeks that you're good, can you do a 48, eat for a day or two, and then go back into a 36 or 48? You can do that for a week, and that would be very aggressive, but that would be too much fasting for a weekly basis. And when you are trying to lose more than 20 pounds, 40, 50, 80, 100, 200, we have to be looking at the week. We have to be looking at what can I sustain weekly? Because this is not going to be an overnight thing. This is not going to be accomplished in a week, in a month, depending on the size of your goal. So what is the greatest length of time that an individual can fast on a weekly basis where most people will not plateau, where most people will not metabolically downregulate? And there's no literature on this, guys. This is just my clinical observation from doing this on patients and myself for the past 20 years. It seems to be 48 hours. 48 hours seems to be that sweet spot where the majority of people can do this on a weekly basis and not create issues. Although you still have to be cognizant, you still have to be careful. You have to eat enough on the other 5 days, adequate protein, adequate calories, alongside all the other pieces. Do I love tesofensine? Yes, tesofensine is awesome. In fact, tesofensine is my backup option for people who don't qualify for whatever reason, maybe medically speaking. If you don't medically qualify for a GLP-1 medication, like semaglutide, like tirzepatide, tesofensine could be an option that may very well be a solution for you, may very well be the solution that you need, because whether it's tesofensine, whether it's semaglutide, tirzepatide, it doesn't freaking matter. Phentermine, we've helped people with phentermine all the time. We implement and coach our patients to implement the FLOA protocol. FLOA, fasting like our ancestors. This is my structured approach towards lasting weight loss, really. And I came up with the name because our protocol centers around a lot of weekly deep fasts. But as I talked about earlier, there's so many more pieces. We really don't care what appetite suppressing medication you use. Our preference, tirzepatide. Okay? Like, that's our preference, but it doesn't freaking matter. A lot of these options can work, and in very many cases do work if you have the right guidance, if you have the right support, and that's what we help you do.